Hello everyone. So for today's video, we will be discussing about the standard precautions and the transmission-based precaution. So ano nga ba ang pinagkaiba ng dalawa? Standard precautions are the minimum infection prevention and control practices that must be used in all times for all patient and situations. Yung standard precaution, ito yung mga personal protective equipments na ginagamit ng isang nurse or doktor upang di sila mahawa ng sakit ng kanilang mga pasyente. At transmission-based precaution naman are used when standard precaution are not sufficient to prevent the spread of infection. Ito yung paraan upang maiwasan ang pagdami ng mga infection. Standard precaution. Standard precautions are used for all patient care. They are based on risk assessment and make use of common sense practices and personal protective equipment used that protect healthcare providers from infection and prevent the spread of infection from patient to patient. Standard precaution. May dalawang uri ang standard precaution. Una ay yung hand hygiene and use personal protective equipment. Hand hygiene is the transmission of norovirus is usually person to person by the fecal oral route and by the contact with contaminated environmental surfaces. Hand hygiene is an effective means of preventing further cases of gastroenteritis. Ang hand hygiene, ito yung paghuhugas ng kamay upang di mahawa ng mga virus, maalis yung mga bacteria sa ating mga kamay, malinisan. And use personal protective equipments naman is the appropriate personal protective equipment should be used if possible in each settings of potential norovirus transmission to the minimize infection risk. So yung pagsuot ng tamang personal protective equipments upang di mahawa ng virus. May iba't ibang klase ng personal protective equipments. Una na dito ay ang pagsusuot ng gloves. Gloves or disposable gloves should be worn if having direct contact with illnesses person, then when it's likely that hands will be contaminated with surfaces or vomit. Ginagamit ang gloves upang di mahawa ng pasyente. At dapat ito ay pagkatapos gamitin, ito ay tinatapon na kaagad. Gown, protective, impermeable gown or plastic apron should be worn if potential exists of splashing. Mask. Norovirus are highly infectious and small number of particles in aerosolized vomit can cause infection. A mask or a surgical mask covered with paper filtered mask should be worn when there is a potential for aerosol dissemination. Isang beses lang sa isang araw gamitin ang mask. At pagkatapos gamitin, itapon na ito agad upang hindi mahawa ng virus. And eyewear for the eye protection. Andito na din yung face shield. Eye protective eyewear such as face shield or goggles should also be worn where the potential exists for splashing. Kasi nga direct contact. So, kailangan lahat ng personal protective equipment mo ay naalis na yung na-dispose mo na upang di ka na makawa ng virus, ng sakit. And the transmission-based precaution. Transmission-based precautions are the second tier of basic infection control and are to be used in additional to standard precautions. For patients who may be infected or colonized with certain infectious agents for which additional precautions are needed to prevent infection transmission base. Transmission-based precaution. Precaution based on the route of transmission of the microorganism. Contact isolation. Use contact precaution for patients with known or suspected infection that present and increase the risk of contact transmission. May mga guidelines na pinapatupad upang masunod ang contact isolation. Ensure appropriate patient placement. In a single patient space or room, available in accurate care hospital. In long-term and other residential settings, make room placement decision balance with the other patient. Dapat may kanya-kanyang sariling kwarto ang mga person na may sakit upang di sila maghawa-hawa. Use personal protective equipment appropriately, including gloves and gown. Wear a gown and gloves for all interactions that may involve contact with the patient or the patient environment. Mahalaga din ang pagsuot ng gloves or gown upang di mahawa kasi nga ginagamot na sila din. Mayroon interaction between the patient and the kaya dapat magsuot ng personal protective equipment. And limit transport and movement of patient. Outside of the room for medically necessary purposes. When transport of movement is necessary, cover or certain the infected or colonized areas of the patient body. Iwasan ang masyadong paggalaw ng pasyente upang di maging hindi mahawa ang niya yung nagagamot. And the enhanced droplet contact diffusion are required for patients diagnosed with or suspected of having infection. Microorganisms transmitted by both the droplet and contact routes, as well as by droplet nuclei suspended in air during aerosol generation medical procedure. And airborne isolation. Airborne isolation is used airborne precaution for patients known or suspected to be infected with pathogens transmitted by the airborne. Example narito yung tuberculosis, measles, chickenpox, and something, etc. Meron ding guidelines ang isolation precaution. Number 1 is the source control. Put a mask on the patient. Bigyan ng mask ang pasyente. At ikaw din bilang isang manggagamot, dapat nakasuot ka din ng personal protective equipment. and ensure appropriate patient placement in airborne infection isolation room. Constructed according to the guidelines of isolation. In settings where airborne precautions cannot be implemented due to the limited engineering resources, masking the patient and placing the patient in a private room with the door closed will reduce the likelihood of airborne transmission until the patient is either transferred to a facility with an air or returned home. Restrict substantial healthcare personnel from entering the room. Suspected to have measles, chickenpox, and etc. if other immune healthcare personnel are available. And yun lamang po. Thank you for watching.